Good afternoon, colleagues. I'll just give it a minute or two just to let everybody join. The webinar's just gone live, so let everybody join. Good to see the numbers of attendees creeping up. It's the standard Easter holidays across the university sector, although of course we're all still working and still doing all sorts of things. But so welcome to this webinar style panel discussion with the Council of Deans of Health. We're absolutely delighted to welcome our colleagues from a range of AHP professional bodies and from the HCPC to have a really good panel conversation about working together better, I suppose, collaborations where we can get some collaborative advantage from working together, where it's important that we stay separate, that kind of thing. So really looking forward to the conversation. If I haven't met you before, my name is Professor Alison Machin. I'm Head of Nursing, Midwifery and Health at Northumbria University in Newcastle, and I'm also the Chair of the Council of Deans of Health. And for those of you not familiar, the Council of Deans of Health is a four-nation organisation representing all of the universities who deliver nursing, midwifery and AHP education across the UK. So the format of the day, attendees will see faces on the screens, and this is the eminent panel that we've got. In the interest of time, I'm not going to get everybody to introduce themselves individually, but colleagues, if you are speaking or answering any questions, if you could introduce yourself and the organisation you represent, that would be really helpful. So we'll get cracking in a minute with the presentation. Just to say that we are recording the session, and the recording will be available at a later date for those of you who haven't been able to join us. We're not going to be monitoring the chat. If you do want to ask any questions in the chat, we'll hopefully manage to follow up with some questions afterwards. We did ask for some questions in advance, and we've woven those into the sessions, and we'll deal with those as they are. But anyway, without further ado, I think we'll kick off with our first speaker, who's going to set the scene really for the conversation, and I think that's really important. So I'm going to hand over to Reena Patel, who is Assistant Director, Workforce and Education at the Chartered Society of Physiotherapy. Over to you, Reena.
Thank you, Alison. So you've done my first bit of introducing myself, so I won't do that. Good afternoon, colleagues. Thank you so much for joining us this afternoon, and my thanks to the Council of Deans for Health for offering us this platform to have this conversation. And the reason that I'm kicking us off, if you like, is because I chaired a workshop with colleagues on the call today earlier this year around our shared approach and learning more about our QAE processes across the professional bodies, AHP professional bodies. And that's the reason why I'm sort of setting the scene. But before I go into what we discussed at that workshop, I think it's really important to say, following on from what Alison was saying about working together, as professional bodies, we do work together on a very regular basis, and it's very much part of our business as usual. And whether that's between professional bodies or as a forum, or with the HCPC. So I guess it's just as you would expect, that conversation and dialogue is ongoing. But that said, we are in a period of transformation. All of it, those of us that are involved in quality assurance of education, we're all looking at our processes, our curriculum guidance, and we're all looking at that. And so it made sense that we all came together to look at that as part of this workshop. Now, I think broadly we work together, like I've said, but there are examples of where we've come together more collaboratively on specific projects. And things that I wanted to mention was the AHP Principles of Practice-Based Learning, which has been co-badged by 10 of the AHP professional bodies. And these principles offer a framework around how to have conversations to support placement, quality and capacity across the system, and that's across practice and education. So that's an example of an area where we have worked more collaboratively together. We also are part of the AHPF, which is the Allied Health Professions Federation, which comprises of 12 professional bodies. And at the moment, there's an ongoing piece of work around AI and how we can offer more support around AI in education. So these are examples of work that we're working on collectively. But I think it's also important to recognise, whilst there is great opportunity for collaboration, we are not a homogenous group. We vary in terms of our size, our governance structure, and our scope and remit within QA in education. And I think it's really important to mention that. But as I said, when we are looking at those of us that are involved in QA of education, and looking at reviewing our current curriculum guidance and our operating models, we recognise that we're all operating in a very different external landscape. And we recognise that for many of the education providers on the call, you are going through processes around quality for multiple AHP programmes within the same institutional school. And so we need to be mindful of those duplicative processes and how we navigate those. In addition to that, in addition to professional body requirements, there's also QA processes within your institutions, as well as other organisations like Ofsted. So this is the time really for us to really think about how we articulate the value of professional body involvement and how we differentiate our role in terms of that enhancement-driven quality assurance, in addition to the role of the regulator as well. So the premise of the workshop that I chaired was around learning about our shared approach, what we do, a deeper dive into what our respective roles around QA in education, particularly around pre-entry, pre-registration, entry-level education, identifying those areas of similarities and differences and where there might be opportunities for collaboration. So on the day, we had 7 of the 12 AHP professional bodies represented, alongside Jamie from the HCPC, Megan from the Council of Deans for Health, and we also had a HEI representative as well. And one of the things we did to start off with was to just look at the lay of the land and sent out a survey to colleagues to find out what our current roles are. So of the 11 who responded to the survey, 8 of the professional bodies play a role in quality assurance, that entry-level pre-registration education. And of the 8, there is a combination of accreditation, approvals and endorsements, so a range. So when I talk about approval, I'm talking about it in that blanket term. And of the programmes that do have professional body accreditation, we asked what proportion of the programmes in the UK are approved by the professional body. Half of the respondents quality assure all courses within their professional arena. For example, the Chartered Society of Physiotherapy, we currently offer CSP accreditation to all UK provision. And the other half that don't, they range from about 25% level of approval up to 90% level of approval. And we spend a lot of time thinking about what the impact of that is. And I hope some of that will be drawn out from the panel discussion today. In terms of the conversations that we had, there were 4 sort of key themes when thinking about where there might be opportunities for collaboration and where there are challenges as well. And the 4 key themes were around defining and understanding quality in higher education, some of the logistical and structural challenges, strengthening collaboration and information sharing, and how we can work together around sharing innovation in quality assurance and professional development. So I'll just talk about those in turn. So in terms of the first theme around defining and understanding quality in higher education, it's really complex. It's hard enough to define it in a profession, let alone across multiple professions, across multiple stakeholders. So it's understanding that variation in how quality is understood and valued at the different levels that we're all working at, and how that aligns to quality standards across multiple stakeholders. And we as professional bodies requiring the sufficient resourcing to help us to maintain that our role and our robustness around quality assurance effectively. One of the things we spoke about was about the role of skilled assessors. So many of us, there is approval that happens within the staffing within the professional body, but also we rely on very skilled, highly experienced external assessors, some are volunteers, some are paid, and how do we sustain that model? The second theme was around logistics and structural challenges, and there's a clear need for process mapping and coordination to improve our approach to quality assurance. And we all recognise that the trend in how we're having to interface a lot more with your colleagues in the quality teams and quality departments, as well as the programmes as well. So how can we think about our processes and think about mapping those processes? The third theme was around strengthening collaboration and information sharing, and colleagues on the call, I hope, will talk about the information sharing that some of us have with the HCPC and the Memorandum of Understanding that some of us have in place, and what opportunity that enables in terms of having purposeful conversations around our respective roles, and whether there is possibility for us to explore. We already do joint approval processes, but where there's opportunity perhaps for shared templates and aligning QA cycles as well. And lastly, the theme around innovation in QA and professional development. We're all doing things within our respective professions around showcasing innovation, but I think what came from that workshop in February is actually there's lots of opportunity for us to perhaps do more in the way of hosting and showcasing AHP in education, sort of innovation in AHP education. And also how we as professional bodies might want to consider memorandums and understandings between us to help in our sort of accreditation and approval processes as well. How we might want to think about that sort of building that educator workforce that can support us with the sort of external reviewing role, and how that could be built into, you know, the advanced sort of professional roles, and thinking about that education pillar. And also thinking about structured pathways for HEI, how we engage with HEIs and education providers, which is really critical. So what I wanted to illustrate really is that this is an ongoing and live conversation. It is a complex one, and engagement with our education providers is critical in that. And our thanks to, once again, to the Council of Deans for Health for offering us the platform to share this, our thinking with you all. Thank you. I'll hand back over to Alison.
Thank you, Rena. Excellent to set the context for the discussion, and just picking up on that point, we at the council see this as the start of an ongoing collaborative conversation that we can hopefully help to support over time at critical times when developments are happening and that sort of thing. So thank you very much for giving us the context for the discussion. And some of the questions that we're going to pose to the panel will pick up on some of those themes that Rena has introduced into the conversation. So the first question from me then is, so what is the value of AHP professional body accreditation, and where might there be potential gaps if all education providers are not accredited? I think Manta and Mike are going to pick up this question to start with.
Hey everyone, so I'm Manta Beaver and I work for the Royal College of Speech and Language Therapists. I look after accreditation there. I'm going to start addressing the first part of the question before handing over to Mike. So the first part of the question asks us to address what the value of AHP professional body accreditation is. We know that terminology does vary between the different organisations, but essentially it's that QA process or accreditation process. Professional bodies are responsive to current and predicted local and national issues which may affect the profession, and once programmes are quality assured or accredited, they can work with HEIs to do this in a supportive and collaborative manner. And it helps to ensure that graduates from the accredited programmes are also fit for academic award and professional practice. Professional bodies will usually ensure a programme is mapped to a detailed profession-specific curriculum. Curriculum guidance can help to ensure graduating learners are able to work in the current environment and are equipped for the future of the profession. A programme which has its links to a professional body is fully conversant in evidence-based practice, and graduates are then more equipped and supported to deal with issues affecting their respective professions from both a clinical and educational perspective. Our respective accreditation or quality assurance processes also set mutual expectations for the curriculum and practice-based learning, thus supporting parity in relation to the knowledge, skills and attributes of the future workforce and ensuring preparedness for delivery of high quality practice. Accreditation can also help to reduce variation amongst programmes. So although some variation is expected, it minimises this, so it ensures a bit more consistency in programme delivery, teaching topics, learner assessment, ratios of staff and students. We also provide ongoing support for HEIs, not just accreditation, such as guidance and guidelines. For example, during the pandemic, many professional bodies supported HEIs in providing additional guidance to both support the learners and the programme teams, as well as placement providers. I'm handing over to Mike.
Thank you, Mamta, and good afternoon, everyone. My name is Mike Donnell, and I'm the President of the College of Operating Department Practitioners. I think it's, first of all, to say that, and this is something that Rena touched on, is that we're, as professional bodies, we're fully aware that accreditation or endorsement of programmes is not mandatory, it is optional. However, we would all argue here that there are a number of advantages that if a HI was to get accreditation endorsement from a professional body, and this would help the quality of the programme and the learner's experience as well, which is really key, and for those feedback for things like NSS, etc. Can I first of all say as well, there's something that Mamta touched on there, which I think is really, really important, which is the reduction in variation in your programmes. As Mamta said, by the nature of higher education, there will be variation within programmes. There's more than one way to bake a cake, but reducing that variation, the HCPC standards of proficiency are very broad, and if you map your programmes to them, you will cover them, but they are very broad, whereas the professional body's curriculum document or standards are far, far, far more specific. And that way you want to get and ensure there's more consistency. And I think therefore then if you've got a learner graduating from Portsmouth or Plymouth or Preston, there's a far greater chance that they will, upon graduation, be fit for purpose, fit for practice and fit for award. Another advantage as well of having accreditation or endorsement is that the support that professional bodies give continues throughout and after that first approval event. And so at any time that a programme team or programme leader can contact a professional body and ask for that support and advice. And if we do not know the answers to it, we can certainly point to somebody else who will hopefully have those answers. We can provide guidance, for example, on disabled students to navigate placements. And as I said, we can certainly signpost to other organisations as well. So lots of advantages for having that endorsement accreditation. I'm going to hand over now to my colleague Kirsty from the College of Paramedics. Thank you.
Thank you so much. Good afternoon, colleagues. So my name is Kirsty Lowry Richardson, and I'm the Head of Education at the College of Paramedics. So following on from the theme around variation, so here at the College of Paramedics, we currently have 25% of programmes endorsed. That's for a variety of reasons, and we're still very much on a journey, both as a professional and as a professional body. And we have paused our endorsement activity whilst we undertook a curriculum review. We did publish our new 6th edition curriculum in April 2024. And just this year, we have now commenced our endorsement activity again. But we're a little bit of an outlier. So it feels like we're able to share some of our experience. So 25% of programmes endorsed, that's out of 81 programmes and being provided across 51 different providers across the UK. So just speaking of the variation, in 2022, NHS England colleagues undertook a thematic review into paramedic education. And one of the risks that was identified by that review was what they referred to as unwarranted variation in paramedic programmes. And that's just part of what we're working with at the moment. But whilst there isn't robust evidence to demonstrate a link between low endorsement and fitness to practice rates, for example, paramedics have by far the highest proportional rate of fitness to practice concerns out of the AHPs. And this is data from 2023 and 24 that I'm referring to. But that data does show that paramedics have a rate that's twice that of most other professions. So the number of paramedics with one or more fitness to practice concerns was 12.8 per 1,000, which is way higher than the other professions. So we're unable to make a direct link, but it's just to point out that potentially there may be a relationship between this and the current low level of endorsement that we have, because that of course relates to a lower level of potential curriculum adherence with what we here as the professional body. In addition to those fitness to practice concerns that I've just highlighted, following a year-long investigation, the Health Services Safety Investigations Body, HCPC, published a report just last month in March 2025 that highlights concerns in variation of paramedic ECG education and training. So this resulted from multiple patient safety concerns and a coronial preventing future deaths order. So our curriculum does include details specifically addressing ECG knowledge and capability, as outlined in that report. But as I pointed out at the moment, we currently have a potential low level of adherence to the curriculum. And it's worth noting that the HCPC SOPs don't include details that are specifically pertaining to ECG, so electrocardiogram. So again, perhaps as a result, it follows that those educations that are not following the professional body curriculum don't have endorsement from ourselves at the moment, potentially risk graduating registrants that could have shortfalls in this area. So those are just two examples of potential evidence that we have that may link to the advantages of endorsement with the professional body. And now I'm going to pass over to Craig. Thank you.
Thanks, Kirsty. Hi, everyone. My name's Craig Murray. I'm the chair of BIOS, which is the professional body for orthoptists in the UK. And I'm just going to give a little bit of a perspective on one of the smaller professions and how we kind of approach this topic. BIOS doesn't accredit any of our HE programs. As you may expect, with a smaller profession, a smaller professional body, it becomes an issue of capacity and ability in terms of what the professional body can do. However, we do approach it in a slightly different way, which still fosters that collaboration and highlights the importance, I think, of full engagement with the professional body to ensure parity across our HEI. So we have 3 HEIs delivering 4 programs across the UK, and all of the heads of those programs sit as permanent members on our Education and Professional Development Committee. And this is really where we ensure the parity across programs. So we have a BIOS pre-registration curriculum that was developed by the Education Committee and signed off and agreed to through a kind of a rigorous review process through that committee. So any big changes or any discussion about how we need to progress the profession forward in terms of what we're educating our students all comes through that committee. Now, that's obviously much easier to do when you've got a much smaller profession. However, I think the principles of that are probably that can be replicated in some way across the board, and it just highlights how important the full engagement is with the professional body to make sure that there is that parity and there's no mavericks going off and doing something that is completely different to what other HEIs are doing. In addition to that, when the HCPC engage with us around developing or updating SOPs and SET, it's that committee that is funneled through. So as I say, it is a little bit easier to keep a bit more of a tight rein in a smaller profession, but I think it does just highlight the importance of that full engagement from all of the stakeholders. I'm going to pass over to Angela Glynn now.
Thanks, Craig. Hi, everyone. I'm Angela Glynn. I'm here representing some of the membership of the Council of Deans for health, and I'm the day job is the Dean of the School of Education, Sport and Health at the University of Brighton. Yeah, thank you, colleagues. So my view on the response to this question really echoes very much what colleagues representing the professional bodies have said, and I think it's just worth remembering that most of us who are in the business of doing the education in the HEIs are also members of the relevant professional body, because it's all a continuation, isn't it? We train, we do the job, we come educate, and we, as Rena and others have said, we continue to work with our professional bodies very much so on various committees and feeding into the development of those policies, guidelines. So I think this is just another arm of the collaboration that's already very strong with HEIs and the professional bodies. And all of that work, I absolutely agree, facilitates the standards, and also really importantly for us, the sharing of best practice between organisations when we're working with professional bodies looking at quality. We're looking at validations of other HEIs work and being able to share best practice and advise and be critical friends. So I mean, they're a really good facilitator for helping that kind of activity to happen. And all of that consistency that's an output of this kind of work supports our practice educators, because they're often working with a number of different HEIs. So it's very helpful to them if we're all singing from the same sheet and expecting similar standards and outcomes for our students. And I think, I know you're going to talk in a minute about the difference, but as the HCPC is taking the regulatory view, as colleagues on the call have already said, it does fall to the professional bodies to really recognise those specific requirements of the profession, which colleagues have just outlined. And certainly from an HEI manager perspective, sometimes, quite often, that is quite helpful for us, because it helps us to make business cases. From an HEI perspective, if there's a written mandated requirement, then we can go to our exec boards and make a case for maybe equipment, maybe staffing. It may be related to staff-student ratio. It may be related to specific skill sets that we need to have in our education team or equipment. So all of that can help. Obviously, there's a risk in the current climate if we over-regulate, over-stipulate what needs to happen and make a course too expensive. There's a risk there to the view from HEI governing bodies of whether a course is viable. So there is an element of risk in that, but it's often used to our advantage in terms of making our cases. And again, really strongly echo what's already been said about the professional bodies being the advocates for the profession. We work as HEIs with a whole mixture, you know, Council of Deans, NHS England, all sorts of different bodies. But it's really that professional body that takes that, we can really depend on to take that wider view of the future of the profession, the regional needs, things like it's often the professional body that looks at the regional capacity of current registrants to support student education in areas, and drives those conversations forward, and looks at the security of the future of the professions, which is really important for those smaller and at-risk professions in particular. So again, very supportive in working those forward. And I think these are all important factors to think about, and for professional bodies to think about when they're validating new courses, new provision in what's starting to become quite a crowded HEI market for health education. So I think the professional bodies for us are the organisation that has the real detailed overview of the profession. Thank you very much, Alison.
Thank you very much, colleagues. Very interesting range of different perspectives, with some clear themes coming through around quality standards, you know, a commitment to maintaining those at the highest level, and also supporting each other in the development of programmes. So that's really interesting to hear from the different professional bodies too. So the second question, I'm moving swiftly on. So what are the distinct roles of the regulator and professional bodies then? And can we consider how both add value or identify areas of purposeful duplication? We usually see that as a negative thing, don't we? But perhaps it's a good thing in some cases. and explore the potential opportunities for greater collaboration. And I think Nadia and Jamie are going to pick up this question.
Thanks, Alison, and hi, colleagues. Thank you for Council News of Health inviting me along today. Really welcome and value talking to colleagues across the sector. So thank you for your time, everybody. So to introduce myself, I'm Jamie. I'm from the Health and Care Professions Council. I'm the head of education here. We're responsible as a regulator for protecting the public, and we do that by holding education providers and programmes to our standards of education and training. Those are output focused to ensure that learners that complete programmes meet our threshold standards for safe and effective practice. Now, clearly the professional body role is different to that, but the thing I would say in an education space is that there is a Venn diagram, and clearly that Venn diagram, there is a large amount of overlap in the middle. And that's, I think, what is really important that we kind of discuss, consider and talk about moving forward when we work together with professional bodies and others. So one of my kind of key drivers and something I'm really keen to do at the moment is to look at how we reduce regulatory overlap and burden in the sector linked in with quality assurance and enhancement. And I think that that's really important for kind of two key reasons, really. One is because it's the right thing to do, and it aligns with our regulatory approach, which is to be right touch in our regulatory activities. So, you know, focusing on the problem before jumping to the solution. So making sure that we're using our resources well and that we're working well with education providers and others. But secondly, because there is currently recognition, I think it's fair to say, in the sector and with government interventions that regulators need to not overlap wherever possible, and where they do that, they should be adding value through that overlap. So there is a kind of particular drive from government currently on regulators preventing growth. I don't think that really applies to our public protection role, but it's still right that as a regulator we consider our activities in line with the push for the regulatory sector more generally. So we've taken leadership on this for at least 5 years now, and since we've moved to our current education quality assurance model, we have seen that model reduces burden and overlap for education providers, and I've got loads of stats and things that I of course can share with people, but for the sake of time I won't do that now. And we do have a vision, I suppose, to move forward on this. So we want to reduce overlap and burden further. But I think it's reasonable that everybody would expect that we need to take small steps to achieve that vision. We want to work with other regulators, professional bodies, education providers and others within the sector to do that. And I'm absolutely really keen to hear what you would consider as the right things that we can focus on to reduce that overlap and burden, and to consider what we can do as, you know, a group of regulators, professional bodies, and other kind of adjacent organisations as well. Particular to our work with professional bodies, thinking about kind of the impact on our assessments, we work really closely with professional bodies. I hope that's come across so far from what colleagues have been saying. We really highly value their work and their independent role. And kind of, I talked about the Venn diagram earlier. It is kind of important, I think, that we recognise and respect our independent roles, and actually that we're not beholden to each other in the decisions that we make. And it's okay for us to disagree sometimes as well. I always think disagreement leads to better decision making in the long run, when you can have a disagreement in a constructive manner. We absolutely, though, really rely on professional bodies to help us understand context and professional expectations when we're doing our own work at the HCPC. And we have lots of good evidence that shows that education providers that work with professional bodies have an easier time, frankly, through HCPC processes. Programmes are often better developed, that they are, you know, are able to align with professional body expectations. It is easier to demonstrate alignment with HCPC expectations, although clearly they're not one and the same thing. We need to understand and are able to understand through our really close work with professional bodies the key changes that professional bodies make to, you know, standards, advice, guidance, and we also expect education providers to reflect on those areas through our monitoring assessments. So, and I think that the kind of the last point that I make here is a really crucial one, and kind of I think demonstrates the value of working with professional bodies. we do see working with professional bodies as something that high-performing education providers will be doing. And actually understanding that an education provider is high-performing helps us to reduce the frequency of our formal interactions with education providers and therefore regulatory burden. You know, and what we mean by that really is being well linked to professional bodies does all of these things that are being talked about today. It ensures that programs can be developing as they need to, you know, kind of looking at the curriculum. It can kind of consider that that kind of national and regional picture, you know, help develop, help to kind of, you know, align with each other and kind of national initiatives, for example. So when an education provider is working close with professional bodies, we see that as a real positive, and that's kind of borne out in the evidence that we have, which kind of shows that providers can reduce the frequency of engagement with the HCPC and therefore reduces regulatory burden. And now we'll hand on to Nadia.
Good afternoon, everybody. I'm Nadia Qureshi. I am the Director of Education and Professional Practice at the British Dietetic Association. I'm glad you could all join us today. I've been given the role to sort of give the other side of that, which is Jamie's started on the regulator and then how that versus with the professional bodies. And actually, he's done really well to share how much collaboration we have, and actually recently so much collaboration. Our joint meetings and such show that a lot of our initiatives dovetail and provide the best, hopefully, groundwork in our work that we do going forwards. I've kind of broken down our key areas into three main focuses. One was on quality assurance, although I don't want to repeat what's been said previously, because we've kind of said quality assurance is one of the key things, I suppose, that is top of all of our agendas. So I won't labour that point. In fact, you know, we can probably move on to that. Although I will say that one of the things that we do look one of the key things that we do benefit from is the adaptability. So once the HCPC has set the standards, we're very much together on how we adapt quite flexibly according to what the workforce needs. So in between accreditation, in between those monitoring times, we can still make changes between ourselves and the HCPC. I know major changes can be brought forwards. We can work together to ensure, you know, that programs remain fit for producing the quality of the registrants that come out. So from that point of view, I'd love to just focus on that. The other things that I wanted to talk about was supporting educators. So in that area, COVID really brought forward how much we were able to support our educators and students when actually there's nowhere else to talk to or turn to. They were able to pick up the phone and speak to us, and we were able to work on it together between ourselves, the HCPC and the HEIs. It was a real indicator of how we can pull together at times of need, and hopefully that will continue going forwards. We provide educational resources, mentorship programs and training guidelines. We run CPD programs, conferences and professional development initiatives. So amongst us, we have those kind of resources between us, even if they're not run individually in our professions. We're very good at sharing those resources amongst us as AHP professional bodies. So that's a great strength for us. We encourage evidence-based teaching methods and curriculum updates, again, sharing those kind of skills with HEIs and HEIs with us. We promote research and innovation in education, so looking at where simulation can be used, how best it can be used, and again, learning from each other on that. And then finally, advocating for the professions. I think it's one of the key things that we do, in that we are safeguarding the roles and identities of our AHP professions, while supporting, you know, really key here, while supporting equity, diversity and inclusion. So making sure that those who want to join our professions have every opportunity to join those professions and to apply for a course at an HEI. We drive interest in careers overall in AHP professions, so we'll always sometimes do joint events with HEIs on doing career events and things to drive interest in our professions. And we also influence national policy and decisions on education and workforce planning. And apprenticeships is one of those key things that happened. It was an initiative that was brought forward. It's now thriving, and some of our professions haven't got there, and they've just started that journey. And some, like CSP, are mature in that journey and have their graduates coming out of the apprenticeship programs. But without professional body support, although it was employer-led, the professional body was very supportive in getting these off the ground, and I don't think it would have happened perhaps without that. And finally, maintaining continuous consultation with educators, providers and medical healthcare professionals, policymakers, a whole raft of people we converse with to make sure that we've got the right skills coming out of our HEI programmes for what the workforce requires. I think finally, I'd just like to end with just saying how I think students are proud of courses that they have passed, which have also had professional body accreditation, and that they feel they've been part of a professional body and a community. So they all have a role to play. And I think students in particular find that they're quite proud of that collaboration between us.
Thank you. Thank you very much to you both for that. Again, a really good demonstration of where the potential collaborative advantage is, but anything that reduces regulatory burden is music to the ears of universities across the whole of the UK. So good that that's in the mind of the regulator. So the last main question, hopefully we'll have time for one of the member questions as well. Considering future steps, what mechanisms can we put in place to facilitate collective discussions when concerns or issues arise, to ensure that we collaboratively identify and implement solutions? I think Laura's going to come in on this, and then Carolyn.
Thank you, Alison, and good afternoon, colleagues. I'm Laura Charlesworth, one of the professional officers for education and accreditation at the College of Radiographers, and really pleased to have been invited to join you all today. Hopefully you're finding it a useful and informative session so far. So I just wanted to take a few minutes just before passing on to my colleague Carolyn to tell you a little bit about where we are and how we might continue working collectively together. And the first of those opportunities I wanted to explain is around the professional body work with the Health and Care Professions Council. So you've already heard some examples of that today already, but we have existing relationships in place, but just wanted to outline that they are evolving, and how we work closely together is also evolving. So our individual relationships with the HCPC include the link to a named education lead, and each of the professional bodies work closely with that individual to work through kind of I guess profession-wide conversations. So if we're noticing trends or issues or positive aspects of what's happening within the profession, we can explore those between the professional body and the HCPC. But we can also do that at a programme level, and I'll give another example of that in a moment. And I think that's a relatively sort of new the kind of process has been there, but the development of that relationship and the regular meetings are really helping, especially for us at the College of Radiographers, we're really finding those really useful. And that platform is there for us to explore issues and identify opportunities, at the early as they arise. Secondly, we work collectively together as a group of professional bodies in the HCPC. And again, we've talked a little bit about that. Rena gave the example of the workshop that we held earlier this year, and that's really the start of us working collaboratively. And I think we're really gaining momentum with that work, and hope to continue to share ideas and suggestions of how we can make everything easier for everybody is really the aim. So that group also includes the Council of Deans for Health, and I think that's really important to explain that we bring our other sort of stakeholders in to those conversations as well. So that commitment is there, and we've got a foundation, and we're continuing to build on that, and more will come from that as we've all explained already during the session today. One of the areas that we are developing, and some professional bodies are kind of further ahead on this journey than others, and at the College of Radiographers we're still exploring this and hoping to progress this fairly imminently, is the introduction of a memorandum of understanding with the HCPC. And this is an important a piece of work because it allows for more timely sharing of information between both parties, which hopefully increases that collaborative working and supports the resolving of any issues or challenges efficiently, and hopefully to avoid duplication for education providers. And I did just want to bring in Kirsty, if you're happy to come in here, Kirsty, just about your sort of recent utilisation of the MOU, working towards sort of some solutions. So Kirsty, can I come in?
Thanks,
Come
Laura.
over to you. Yeah,
absolutely. So here at the College of Paramedics, we signed a memorandum of understanding with the HCPC a year ago now, last April. And we've already had, I can't speak of details, but we've already had 2 really positive examples of utilising the MOU to quickly share information where live issues have arisen. And we've still got work ongoing, but what it has done is it's absolutely cemented our ability to work really closely together as the professional body and the regulator, and to quickly start to address issues, as you said, Laura, with hopefully the advantage of it not being a protracted period, whilst we can turn issues around and get positive outcomes for everybody involved, but particularly learners that are affected in that time. But yeah, really positive experience of that.
thank you for sharing that, Kirsty. And I think it's fair to say that, you know, there've been some early adopters of the MOU, and it's really great for those of us that weren't so quickly to adopt, that we're hearing kind of the real positive impact that's having, and lots of us that haven't got an MOU in place at the moment are currently exploring that. So we have several different opportunities, different contact points between the professional bodies, collectively, the HCPC, other key stakeholders, and they, you know, are really helpful opportunities for us to share sector-wide issues. And one of the examples that we've also got in place that I wanted to share is a meeting that we have with NHS colleagues, which I understand it was actually before my time, but I understand that was actually introduced during the COVID pandemic. And gave an opportunity fortnightly to come together. So that's another opportunity where, as a group, we're able to share concerns and escalate any sort of issues that need that timely attention. So we have all of those platforms in place. I think we're working really well together, but we've all committed to wanting to continue to progress that and make sure, you know, that we're all learning from each other and helping sort of reduce any duplication that there might be that we can do. I just wanted to offer Carolyn the chance just to bring some examples to life, really, just around sort of hot and current topics of where the platforms that we've got to come together have enabled some sort of speedy working on some current topics. So Carolyn, if I can hand over to you, thank you.
Thanks, Laura. Hi, everybody. I'm Carolyn Hay. I work at the Royal College of Occupational Therapists, RCOT, in the role of Head of Education. So nice to be with you today. So yeah, as Laura said, and I think Rena's touched on some of them, just wanted to give some examples really of where we're coming together and also our future plans. So we come together in a variety of different ways, ad hoc, but also more structured. And we do that across different contexts, both relevant to quality assurance, but also the wider conversations around education and thinking there. So a couple of years ago, I was approached by a colleague at the CSP who'd had the brilliant idea around developing a set of placement principles, all coming from a conversation around challenges with placement capacity and placement quality, and particularly post-COVID. And as people have mentioned, you know, there's been a huge amount of growth in the programmes recently and things like that. And it became really clear that we've got similar challenges, but we've also got similar strengths, and that we were stronger together. So we launched those, but immediately started having those conversations with the other professional bodies, AHP professional bodies. And within a year, we had a new set of, well, the same set of principles, but updated with just a couple of little tweaks really to make sure that they felt really relevant to all the AHPs, and they've been co-branded by 10 professional bodies. So they're a great example of where it's helpful for us to come together. And I think particularly To see them now being integrated into different learning and development standards has been brilliant. A lot of us reviewing our standards at the moment, and we're seeing them pop up in that. I think also it's been really helpful for people who are managing and leading across different AHP education programs and also across different practice settings. We want to be working together, and so so that we can support our members where we can, and all our professions, and where it's right to be doing that. More recently, we've come together with HCPC and NHS England, focusing on the principles, AHCPC's principles of preceptorships. We love principles, don't we? So principles of preceptorship, we were focusing on there. Again, the principle of being stronger together and supporting those developments of those principles and the NHSC framework that was attached to that. So again, something for new graduates, those returning to practice, or employers of newly registered individuals, to really support them after they've had their brilliant education for a smooth transition into practice, and hopefully support their retention and their growth as a new AHP. We've also been working on a set of, I say we've been working on, I haven't been part of this group, but as AHPs, we've been together working on a set of AI in education principles. Again, applying that logic that there are times where it's absolutely right that we should come together, pool our knowledge, pool our expertise and resources, and create something that will benefit all of us. And as individual professional bodies, we're quite a range of sizes between us, but our collective strength is really important, and we recognise and value that. And I think that's shown in our attendance here today, but also our engagement and commitment in taking forward the different conversations that we're all having. In terms of how we work with HCPC, I'm conscious there's some repetition in what we've shared a little bit today, but we do all have individual relationships with HCPC and together attend their education forum meetings. But most recently, Jamie approached us in terms of shaping some of the wording on their website around text in relation to how we all work together. And that was great to be able to do that collaboratively, have an open conversation, produce a collaborative piece of text. And I think we all appreciated Jamie's openness to working together and inviting us to do that, to ensure that future AHPs can have the best introduction to their chosen profession, and recognising and helping everyone understand the roles that we play within that, and being really visible about that. So the last part of this question, I think, was about future plans. And as Rena started by saying, so we're going full circle here. It's a bit like we planned it, isn't it? But going full circle, as we met in February as a group of professional bodies, we generated a lot of different ideas, and coming together in person always adds an extra dimension, doesn't it? So we were thinking there about how we can further enhance, because we do work together, so further enhance the ways in which we work together. And I think we've been proud of a lot of what we have achieved together, really. But one of the things we're looking forward to doing now is thinking about the concept of the memorandum of understanding that we have individually, or some of us have or are working towards with HCPC, but looking at considering ones across us as professional bodies. And that's something we're going to take away and have a think about how we can develop that over the next few months. But it will give us an opportunity to share information potentially when we're working together around quality assurance and accreditation of our pre-registration programs. So we're looking at how we can do that, take the learning from our work with HCPC. It will allow us to share programme level information to support accreditation and quality assurance. So only last week I had an accreditation event with another professional body, and it was great to have those conversations pre-event, check where we're aligned, check where we can look at things together, particularly relevant to our specific professions, but also where we're coming together, so that we can maximise the time that everyone's giving us, so all those key stakeholders and the university course teams, and reduce duplication. So that's our next step, is the MOU, and I hope that demonstrates our commitment really to working together as professional bodies, and working all of us together with HCPC, and the impact that we've had, so that we can support really good quality education programmes and the development of our own professions. So I'll hand back to you, Alison.
Thank you. It's really interesting, specific examples and things, and I think that's what brings something like this to life, isn't it, in terms of what's actually happening on the ground. And it seems like there's a lot of energy around. We're getting short of time in the session. Doesn't an hour fly by when you're having fun? So instead of posing another question, I was just going to come back to the panel and just say, is there anybody that would want to jump in to add to anything that's been said around any of the three questions, or anything that you want to say? One of the questions from members was actually about staff-student ratios and the concept of that, and how accurate that is as a thing. I'm thinking that's a whole session in itself, to be honest, trying to bottom that one out between us all. But is there anything that anybody else wants to add to the session?
I'm happy to jump in about SSRs if people wanted to. Yeah, I can do that.
We've only got about 4 minutes.
Give me 2 and we'll sort it. We'll sort the hot topic. So yeah, I think staff student ratio is a really hot topic, isn't it? Sometimes quite a heated point of discussion between different people in different roles. RCOT, the SSR isn't a standard. It's a piece of evidence to support the implementation of our learning and development standards. And that's around ensuring that programs are appropriately staffed. So it's about having the right number of staff, but it's about the breadth of experience those staff have got, the number of staff who've got, the breadth of experience they've got, and essentially about delivering a quality and a sustainable programme for the duration of that accreditation period, and a sustainable suite of programmes. We're seeing universities offer a whole range of programmes now, and we want to make sure that your graduates have your employers of your graduates have real confidence in those graduates, and that staff wellbeing is really well maintained within the delivery. So I think for us, that's the conversation. Is SSR often becomes that quantitative measure, doesn't it? But ultimately what we're looking at is how can you deliver a sustainable quality course that people have confidence in, and that your staff are well looked after in doing that. You know, a lot of us come from the university backgrounds. We have been on the other side, and we know that things are increasingly pressured as you're managing different budget lines. But hopefully some of the things you've heard today help maybe give a bit of understanding about what we're looking for, where our drivers come as professional bodies, and what we're wanting to do to really support the quality. And I think then in thinking about how we find measures to assure us of that, the SSR becomes a conversation which we all enjoy the conversation, but recognise it can be challenging. So I can see Jamie's got his hand up too.
Thanks, Carolyn. I just wanted to say thank you for bringing in the notion about staff wellbeing in the university setting as well. That's very kind of you. Thank you. Jamie.
My point wasn't actually going to be about staff student ratios. That's okay, Alison. I think I just wanted to kind of comment a bit more broadly, because I think there's been so much good stuff talked about today, and we work really closely, everybody in this kind of virtual room. I think that it feels to me, and hopefully colleagues will agree with me here, that anybody can sit in a room and say, hey, wouldn't it be great if we could do this? Wouldn't it be great if we got to this place? And everybody can sit and nod and agree. And then sometimes you don't really get anywhere with that. I really feel like we are a group now that is set up and established where we are starting to move to that next step. I think we've got some good green shoots. We're starting to bear some fruit, even maybe in certain areas. But I would really say that, and for colleagues in the room from education providers, we're really starting to try and grasp this properly and move on to, okay, so how do we get there? How are we going to make things better? How are we going to reduce the burden in these areas? It's those kinds of questions that I really feel like we're getting into the meat of now. So I just wanted to hopefully, assure people in the room that I feel that we're moving on from talking about this being a good idea. we really do feel that we are in a good position now to kind of take that and to bear some fruit, and to of course take little steps, and kind of recognise where we're able to do things and where we're able to not. But it certainly feels that we're well positioned to do that, and I hope that colleagues, and I'm sure that they do, and professional bodies would agree with me there as well.
Thank you. Thanks, Jamie. And I'm just going to put you on the spot for the last minute as well. And it almost feels like the elephant in the room that we're not talking about the NMC and nursing and midwifery, and quite a lot of the deans and PVCs have got the whole suite within their responsibility. So I just wondered whether you could just, I know that you're working closely with the NMC around lots of different agendas. I just wondered if you could just give a few words of reassurance about that.
We do. So I think, I wanted to kind of particularly focus on professional bodies and how we work with professional bodies for the AHPs, but we work really closely with the NMC. We are actually looking at working on an information sharing MOU, but we don't necessarily need to have that in place to discuss the bigger things. So we both have regulatory powers within our legislation to be able to share information anyway. So I think an MOU would kind of just help us to do that in a more structured way. I think there's also something about other regulators. So actually, Office for Students, Ofsted particularly, aligning better with them, not just as the HCPC. And I don't want things that I don't want. I don't want one-to-one relationships. Oh, I do want those. They're really important. But I think group relationships are also really important. So I want to come together as a group of regulators to be able to instead of us asking you 9 questions, it's 9 health and care regulators in the UK. How can we ask you 1, or even 8 to be better than 9, right? So if we can get good alignment between just a couple, then I think that should be extremely helpful. So I don't mind being put on the spot, Alison, and hopefully that's helpful.
Fantastic. Thank you very much. Colleagues, we've come to the end of the time. Thank you very much indeed for your engagement, to all of the panelists for the discussion. I can see some feedback in the chat to say that it's been very well received by the attendees on the call as well. So hopefully we'll get the chance to do this again in another few months with a different topic to talk about perhaps. But thank you very much for joining us this afternoon, and enjoy the rest of your day. Thank you.
Thank you. Thanks, Alison. Bye all.